Situation: 77-year-old female named Jacqueline Cunningham came into the hospital with the admitting diagnosis end-stage kidney failure, admitted to the urology unit on March 27, 2019. The primary physician is Joe Smith. She is a fall risk, no isolation precautions or restraints, patient on seizure precautions, possible consideration of a kidney transplant.
Background: history of acute kidney injury, diabetes mellitus, hypertension, and renal artery stenosis, and recurrent severe infections. No known allergies, full code, patient is on hemodialysis, English speaking, Sister Ula at bedside.
The assessment was ANO times 3, lethargic, slurred speech, patient was short of breath, crackles heard on auscultation, no oxygen supplemented ordered, decreased skin turgor, dry ashy skin, Foley was placed last night, 20 milliliters output, urine very concentrated, sent urine for urine analysis, waiting on results. Patient is independent, limited mobility. Lab tests are serum creatinine 6, BUN 10, GFR 10. Diagnostic procedures done for tonight are ultrasound, KUB, a CT, MRI without contrast, and kidney biopsy to make sure the patient meets certain criteria.
So recommendations are to continue to monitor respiratory and cardiac status, protect from injury, and place on seizure precautions, and make sure that the patient is on fluid restriction, to promote rest and encourage the patient to ask questions and to address their fears and provide emotional support to the patient. Treatment options for end-stage kidney disease include holistic treatment approach with dietary considerations to make sure to restrict dietary sodium, potassium, phosphorus, and magnesium, to promote hemodialysis treatment and kidney transplantation. Good morning, Jacqueline. My name's Catherine. I'm going to be your nurse today. How are you feeling?
Hi, not too great. I can't stop vomiting. I'm very tired and this Foley's driving me crazy.
All right, let's check it out. Okay, well, your urine is very dark, but that is common for people with kidney disease.
Hi, I'm Ursula. Sorry, I just stepped out to get some coffee. Such a jokester.
How do you guys know each other?
Oh, this is my sister. Sorry.
Okay. It's nice to meet you. I'm just checking in on Jacqueline. Have you spoke to any of your doctors this morning?
Yeah, one doctor. I forgot his name though. He said something about her needing a new kidney. What does that even mean?
This is very scary for me and I'm really overwhelmed. Can you explain this?
Yeah, so Dr. Smith came to speak with you this morning. Unfortunately, your kidney has progressed and is no longer manageable by dialysis alone.
What do you mean dialysis isn't going to work? I've been going 3 times a week for the past 5 years.
Unfortunately, hemodialysis is not a long-term cure for kidney disease, and your doctor feels the transplantation is a better option in your case.
So how does the transplantation work?
So there's a lot of preparation that goes into the transplantation process. There's 2 types of organ transplantations. One is from a living donor and one is from a deceased donor.
Perfect. Can she have my kidney?
No, you need your kidneys.
Well, actually, you only need 1 kidney to function normally, so in some cases this is possible. However, we will go through extensive testing to ensure that you are a match and can give your kidney to your sister.
So can I do the testing now?
Okay, I'll let your doctor know.
Awesome.
Good luck.
Hi guys, so we got the results from your blood testing.
Am I a match?
Unfortunately, you weren't a match, but let's explore other options for you.
What do you mean?
So we could put you on an organ donation recipient list and you are still eligible to receive a kidney from a deceased donor.
What do you mean deceased?
So let me explain how a deceased organ donation works. There's a lot of criteria for this.
Okay.
In order for a person to become an organ donor, blood and oxygen must flow through the organs until the time of recovery to ensure viability. This requires that the person die under circumstances that have resulted in fatal brain injury, usually from massive trauma resulting in bleeding, swelling, or lack of oxygen to the brain. Only after all efforts to save the patient's life have been exhausted, tests have been performed to confirm the absence of brain or brainstem activity and brain death has been declared, is donation a possibility. The state and national Donate Life registries are searched securely online to determine if the patient has personally authorized donation. If the potential donor is not found in the registry, his or her next of kin or legally authorized representative, usually a spouse or relative or close friend, is offered the opportunity to authorize the donation. Once the donation decision is established, the family is asked to provide a medical and social history. Donation and transplantation professionals determine which organs can be transplanted and to which patients on the national transplant waiting lists the organs are to be allocated.
So what's the next step?
After the patient has been declared brain dead, a team from the organ procurement organization will come in to assess the body and get it ready for donation.
Well, how long does that take?
Unfortunately, that isn't up to me. The OPO is responsible for tissue and organ procurement. I will keep you updated on the organ donor status, and in the meantime, just rest, and if you need anything, let me know, and here's your call bell.
Thanks so much for everything, Kat.
Hey, can you come check with me on the patient in room 31A? She has no pupillary reactions, no reflexes, and no responses. I'm going to perform the second clinical neurological exam and then perform the EEG.
Okay, no problem. Just give me 1 second because I have to call the technicians to put on the electrode to the EEG on the patient. No?
Okay.
CCU nurse is told that her patient is now brain dead, looks at the license, finds an organ donation card, speaks with the family about organ donation, calls to tell that she has a donor, gives the blood type, etc. The scene cuts off to the critical care nurse. She's getting notice that the patient that she has had over a week that came up from an ER due to a brain injury from a motorcycle accident is getting a second brain exam.
The organ procurement team was called. They've done their assessment. I think this patient is a good candidate for an organ donation.
Okay, sounds good. I'll talk to the family.
The doctor and the nurse do the evaluation that consisted of an absence of pupillary response to bright light, oculovestibular reflex testing, in which ice is put into the ear canal and the eyes would not deviate towards the water. Absence of corneal reflex. Absent corneal reflex is demonstrated by touching the cornea with a piece of tissue paper, a cotton swab, or squirts of water. No eyelid movement should be seen. Absence of the pharyngeal and tracheal reflexes. The pharyngeal or gag reflex is tested after stimulation of the posterior pharynx with a tongue blade or suction device. The tracheal reflex is most reliably tested by examining the cough response to tracheal suctioning. The catheter should be inserted into the trachea, followed by 1 or 2 suctioning passes. An absence of facial muscle movements to a noxious stimulus. In addition, the technicians placed the electrodes onto the head, and the patient should not have somatosensory, which is sensation such as pressure, pain, or warmth, or audio-visual stimulus.
Organ procurement team was called. They've done their assessment. I think this patient is a good candidate for an organ donation.
Okay, sounds good. I'll talk to the family. Hello, Mrs. Cortez.
Hi.
The doctor has discussed the test results.
What about?
We performed the second neurological exam, and it seems that your son has a lack of pupillary response.
What do you mean? What does lack of pupillary response mean?
Honestly, it means that your son doesn't have any electrical activity going on in his brain, so that means that he's not going to wake up. The doctor confirms that the patient is brain dead. Along with the CCU nurse, the transplantation team is here now to discuss the final process of organ transplantation. After the confirmation with the patient, with Mr. and Mrs. Cortez, the organ procurement team will make sure that the patient does not have any obvious contraindications such as a virus, sepsis, hypertension, kidney disease, drug problems, alcohol problems, or cancer. The organ procurement team will do a series of tests such as the serum antibodies. This can change and can be difficult if the patient has been pregnant, has had several blood transfusions. Tissue and blood typing and cross-matching will also be done. Other patient information includes height, weight, and hospital zip code. This information will be put into the UNO system so that the patient that has the most needs will have the organ donation available. Kidney and pancreas are one of the only organs that can be held until the surgeon can decide whether the recipient is going to be optimal recipient. The factors that a surgeon takes into consideration is the blood typing and whether you and the recipient have the same blood type. The next is tissue typing called human leukocyte antigen. This test compares genetic markers that increases the likelihood that the transplanted kidney will last a long time. A good match means that it is less likely that your body will reject the organ. Lastly, cross-matching test involves mixing a small sample of your blood with the donor's organ in the lab. Donor's blood in the lab. The test determines whether antibodies in your blood will react against specific antigens in the donor's blood. A negative cross-match means that they are compatible and your body isn't as likely to reject the donor organ. A positive cross-match, however, means that the kidney transplants are also possible but require additional medical treatment before and after the transplant to reduce the risk of your antibodies reacting to the donor's organ. Other additional factors that should be considered are age, kidney size, and infection exposure. Hello, Ms. Cortez. Do you want to have a seat? The doctor will be here to discuss the test results.
The doctor discusses that the test results concluded that unfortunately the patient is brain dead.
I understand it seems overwhelming. I'm here to give you information regarding organ transplantation. Organ transplantation is surgically removing an organ or tissue and placing it into another person. Transplantation is necessary because the recipient's organs has failed or has been damaged by...
I want to donate my son's organs.
On your son's license, it's specified that he would like to be an organ donor.
Okay, if those are his wishes, then I guess we should.
Okay, thank you.
Hi, how are you doing?
I'm so sick of being here and feeling like this.
Well, I come with good news. We have found a donor for your kidney.
Wow, that's amazing news. Just what I needed to hear today. So, what's the next step?
Well, there may be some medical conditions that affect the risk of transplant for you, so we need to run some tests to make sure that you're fully eligible to receive the kidney.
What does that include?
Well, usually someone who has serious heart disease or not being healthy enough to survive an operation, obesity, smoking, or an active infection. And after we rule out all of these, you'll be ready for transplantation. You seem concerned. What's bothering you?
Well, I'm very nervous for this transplant. It's very dangerous now.
I know the doctor spoke with you earlier, so I just want to reinforce what he already said. The benefits outweigh the risk, but with anything, there are always going to be risks. Most importantly, there's the possibility of organ rejection, which will be manifestation by fever, hypertension, and pain at the implant in the transplant site. If that occurs, we will have to remove the donor kidney. The most important thing to remember is to follow your pharmacological regimen and take all the medications you need to, which the doctor will discuss with you, and to notify your provider immediately if any symptoms occur. Another thing that can happen is a blood clot, and that can form in the major vessels of the transplanted kidney, and lastly, an infection. And lastly, an infection can be possible. It's very important to detect this early, so look out for low-grade fevers, mild reports of discomfort, or mental status changes.
Wow, this is overwhelming.
It's for the best. Everything will be okay. What happens after the transplant? I just go back to living a normal life?
Well, not exactly. You'll be placed on a couple anti-rejection medications, most likely prednisone or cyclosporin. It is very important to take these medications for the rest of your life in order to make sure your kidney will still work.
What kind of foods am I allowed to eat?
You want to follow a low-fat and decreased cholesterol and a high-fiber diet to decrease your constipation. It is very important to Increase protein to promote healing and to rebuild and maintain muscle mass. You want to restrict your sodium intake to prevent fluid retention and hypertension, especially if the doctor prescribes you on prednisone. And if he puts you on cyclosporine, make sure to take magnesium supplements because that medication can reduce magnesium levels.
I have a question. We love going to the gym together. Will we still be able to do that after the transplantation?
Of course, you want to increase your activity level as tolerated, of course. You just want to make sure to avoid any kind of contact sports that could cause injury to your transplanted kidney.
This is amazing. I can't believe it's actually happening.
I know you are very overwhelmed right now and you will probably be nervous after the transplant, but I assure you that there are many resources available to help you. I will print out a handout with the websites and the phone numbers to organizations such as the National Kidney Foundation so you feel more comfortable. Do you have any other questions?
No, I think you covered everything.
Okay, awesome. The doctor will be in a little with the informed consent forms and will explain the entire procedure to you in great detail. I will be back in a little, and please press the call bell if you need anything.
Thank you so much, Kat, for everything. You've really been so great.
Good morning, everyone.
Hi. I'm so excited. I'm getting a new kidney.
Yay!
Yes, I'm sure this is very exciting for you. There's a few things we have to go over before you can go for surgery. The doctor will be going over all of your pre-op lab work, which is going to be the blood chemistry studies, your CBC, your differential, your bleeding times, and urine culture. We also have to check your blood type and cross-match prior to the procedure. So we're going to go do that.
Okay.
Okay, great.
Okay, so you're all set. I'm going to be giving you your pre-op meds now.
Okay, yeah, the doctor said that I'm gonna be getting antibiotics prophylactically and an immunosuppressant therapy.
Yes, can I just see your bracelet? Can I have your name and date of birth?
Jacqueline Cunningham, 053197.
Okay, you have any allergies?
Nope.
Okay. So I'm going to be giving you your cyclosporine. It's an immunosuppressant medication to prevent the rejection of your donor kidney. You also will be getting methylprednisone, and this is an anti-inflammatory and an immunosuppressive. It's to decrease the immune response and inflammation rejection of your kidney. You have received your dialysis within the last 24 hours, and I believe you're all set. I'm going to introduce you to the transplant team that we will be involved today. Do you have any questions before we leave?
I'm ready.
Okay.
Yay, it's time. Today's the day.
For the first hour, Catherine comes in every 15 minutes to check vitals and check urine output.
Hi. How should you be doing today?
Pretty good. The doctor came in, he said everything went well, right?
Yes, it did. We'll be monitoring her, and it's important that you remember to tell the doctor right away if she's feeling any kind of fever. I'm going to keep checking her vitals, but in case she starts to feel like she's getting a fever, if there's any drainage from the incision, and if you notice that it's red, and you also have to just make sure that she's adhering to her medication regimen.
Yeah, I have a whole list of the medications. So.
Yes, and you also have to follow the specific diet we spoke about.
Yeah, I will cook for her and make sure to make it a low-fat diet to decrease her cholesterol and high fiber so she doesn't get constipated. I will also make sure she eats a lot of protein to promote the healing.
Yes. And make sure low sodium so she doesn't have any fluid retention. And also because she's on the cyclosporine, I just want to make sure that I let you know she cannot have any grapefruit because it will alter her blood levels.
Right, no grapefruit. She knows.
She's probably a little tired.
Yeah.
Okay, and just make sure that you contact your doctor right away if you're feeling anything like we said. If you're having any difficulty urinating, make sure you weigh yourself or make sure you weigh her every day, how much that she's urinating, and just make sure that you keep in mind that you're at a very high risk for infection.
Great. I'll make sure to keep that all in mind to make sure everything goes good.
I heard everything.
Okay, good.
Thanks.
Hello? I'm sorry. Did I just make you up to sleep?
You scared me.
Oh, I'm sorry. Catherine's going to do the session on another picture. She's busy at the moment. I'm the nurse manager. Would it be alright if I assess you? Yeah, let's go. Yeah, let's see. Stand up.
She's got a good kidney.
So
There should be some scars there. Yeah.
Not a problem. Can I see your bracelet? Can you tell me your first and last name and date of birth?
Jacqueline Cunningham, 05/31/97.
And can you tell me where you are?
The hospital.
Okay. Can you look at my finger? We're gonna look at my finger and see where it goes. Stick out your tongue. Okay. I'm gonna be listening to your breath sounds. Okay. Deep breath in. Deep breath out. Deep breath in. Deep breath out. In. Out. In. Out. Okay, I'm gonna check your heart sounds. Okay, sounds good. I'm gonna listen to you're gonna listen to your GI, to your stomach and everything like that. I'm gonna do a assessment of that. So you can lay back down. I'm sorry, this is gonna be inconvenient. Could you pull up your shirt for me? Thanks. So, everything looks good. Just checking bowel sounds. So your incision looks good. It doesn't hurt, right?
No.
It looks perfectly fine and well kept. Your Foley bag seems to be good. You're draining adequately, and you seem to not have any swelling in your legs. So you seem to be good, in good shape. So I'll let Catherine do the rest of the stuff.
Thanks.
No problem. Hi there, Jacqueline. Thanks for coming in for a checkup. How are you feeling?
I'm feeling okay, thanks for asking.
Can you tell me how you feel like you're coping with your kidney transplant?
Honestly, as thankful as I am for getting the transplant, it's impacted my life tremendously. I find that I've been struggling or finding myself getting annoyed having to take so many medications just to make sure that I don't reject the organ.
Can you please tell me the medications you are on? I want to make sure that our records are up to date.
Sure. Just to prevent rejection alone, I'm on prednisone, cyclosporine, and bacillomexab. I'm also on stool softeners to prevent straining, constipation, and I'm on a low-fat, high-fiber diet.
Okay, this is what I have here. Thanks for confirming. I'm happy to see that you're healthy and thankful.
Thanks.